girls who get pregnant, this is, they've gotten fistula, they got all fistula, but thank God there is a program in Liberia which we have been supporting to, repair have the surgery available to repair the fistula, and very importantly, to also give some skills and a confidence for these girls that they can go back to their communities and be stronger and be in charge of their own lives. So that was, seeing the girls and being with them was something you will never forget. I was also really struck by the fact that they look so young and they are so young. And that's after they have had a pregnancy and almost died of a pregnancy. So that's an illustration of a good thing that at least we saved these women, but every year more than 500,000 women continue to die during pregnancy and childbirth. And largely, these are from problems that we can prevent. We know what to do, and therefore it is true that maternal mortality remains the sort of the biggest or the largest health inequity in the world. And it's the goal, the maternal mortality goal of the Millennium Development Goals is the one that's lagging the furthest behind. So the least progress has been made on that so far. So in other words, of all health indicators, maternal mortality displays the biggest or the largest gap between the rich and the poor, both within a society and also between countries. And just to give you an indication, some of you know these figures, but here in the Netherlands, for example, the risk of a woman dying as a result of pregnancy and childbirth during her lifetime, the lifetime risk, is 1 in 10,000. Actually, it's 1 in 10,200. So, very rare event, which is what we want. Now, then on the other side, you have many countries such as Niger, where that same indicator is 1 in 7. 1 in every 7 women is likely to die because of childbirth or pregnancy during her lifetime. So it's a huge issue which also isn't being given the attention it requires. And young girls obviously are at much greater risk. They're not yet ready in physical terms, basically, even if you don't talk about anything else. Physically, they're not able to have a pregnancy that will succeed in medical terms. So here, because this is such a neglected issue and it requires a lot of political attention, I want to just mention that your government, the Netherlands government, has taken a very important initiative. They are putting this high on political discussions in the international arena. And as part of that, together with UNFPA, the Dutch government is sponsoring a high-level event on maternal mortality next month in Addis Ababa, where different governments and different partners will come together. So that's an example of a very important way in which we can contribute to making advancements on issues that are basically still a little bit invisible or not given the kind of attention, particularly at times when there are other issues also that are crowding the public attention and the political attention. Basically, there are 3 interventions that we know work for better maternal health. And these are, first of all, voluntary family planning, so that those who don't want to get pregnant are able to delay or postpone or avoid pregnancy. Second, for those who are pregnant, that they have skilled care during the delivery. So basically, in most places, this would mean a midwife, like here. And thirdly, for those who actually experience a complication, that there is availability or transport to an emergency care. So there are 3 proven interventions. And maybe interesting to note here that it's estimated that ensuring access to family planning could reduce maternal deaths by 25 to 40%. So it's a big part. And child deaths by as much as 20%. So again, it's not often understood that making family planning available is not just a choice that we want people to have. It actually avoids deaths, deaths of children and deaths of infants and deaths of mothers. So that is very important for us to recall. Now, as you can see from the next slide, the percentage of women using modern contraception does vary greatly across regions. So we see here that the use is highest in Asia, then followed by Latin America and Caribbean, South Asia, and the least is Sub-Saharan Africa still. But also important to recall at the same time is that while in some cases and in some regions in particular there is low use of family planning, there also exists a demonstrated, we know, unmet need for family planning. So when you ask women, young people, couples, would you want to use family planning if you could have access to that? They will definitely say yes, a large number will. About 200 million women actually today would want to use family planning, but they are not because they, for whatever reason, are not able to access safe and effective contraception of their choice. Sometimes they may have access to one method, but it's not the one that they want. And as you can see from the next slide, this shows women in Sub-Saharan Africa and South Central Asia. The light blue and the orange sections on the right account for, together they account for more than half of women worldwide with unmet need for modern contraception. So those are the largest portions of women who don't have access to family planning. And of course, generally unmet need is higher among women who are younger. It's harder for younger people to access, and for those who have less education, and also generally those who live in rural areas. And then in overall, it's the poorer women who always have less access than the wealthier women. And we can see that in the next slide. Here we see the difference between the poorest, which is the blue bars, and the wealthiest households in orange in 3 different regions. So in each case, the pattern is the same. It's the poorer who are using less contraception because they have, so that those who are really in need and more in need than others get the first priority, and not assume that everybody has the same need. And often, also there are other issues such as service providers or those who provide either the care or the information. They kind of discriminate either overtly or in attitude and in the way they relate against the poorer and the more marginalized populations. So it's actually quite a challenge to make sure that services are effective. So to summarize about family planning, while worldwide the percentage of women using contraception rose from 47% to 56% in the last 15 years, so there's been progress, there remains high unmet need for family planning. And there is, of course, really an urgent need to make sure that we invest our resources, our attention, our technical expertise, and collaborate together to make sure that these services are made available. And so here maybe I'll just touch very quickly on the issue of funding for family planning, because this is actually quite interesting and a bothersome fact, because as a percentage, funding, the monies going to family planning have decreased out of the total population funding. And yes, here on this slide, down at the bottom, you can't really read it, but that's funding for family planning. And on top, you can see the funding for AIDS programs, for HIV/AIDS and other sexually transmitted infections. So, and over